I'm Dr. Kimberly Liu. Through this video, we hope to help you better understand what a tracheostomy tube is and what having one will mean for you and your child. A tracheostomy is a surgery in which a tube is placed in the center of the neck into the windpipe, also known as the trachea, to help someone breathe. There are many reasons why a child may need a tracheostomy. Some children have heart or lung problems that require a breathing machine or ventilator. At first, this is managed with an endotracheal tube through the child's mouth or nose. If the child is expected to need a ventilator for months or even years, a trach is often recommended as a safer, more comfortable, and more manageable option. Some children need a trach due to narrowing or obstruction of their airway. There are many possible causes of an obstruction, but the purpose of the trach is the same: to bypass the blockage and make an open airway that allows air to pass into and out of the lungs. Some children are at risk for pneumonia because they cannot prevent mouth secretions from getting down into their lungs. For these children, the purpose of the trach is to allow caregivers to suction the lungs and clear the secretions. The trach doesn't necessarily prevent the secretions from going into the lungs, but the ability to suction through the trach reduces the risk of pneumonia. Some children outgrow the need for their trach after a year or two, while others need the trach for longer. Every child is different, and your care team is here to support you and educate you on what your child's needs are. On the day of surgery, your child will be taken to the operating room and will be asleep with general anesthesia. The procedure itself takes about 30 to 60 minutes. Your child's surgeon will make an incision in the skin on the neck. The tracheostomy tube is then placed through this incision into the windpipe. The trach tube is held in place with a tie that goes around your child's neck. You'll notice 2 additional strings attached to the neck. This is a temporary safety measure and will be removed later. After the surgery, your child will be kept under sedation for several days to allow the site to heal and to prevent the trach tube from coming out accidentally. To ensure that the trach does not get dislodged while it's still healing, we ask that you please wait to hug or hold your child until after the first trach change. Once the site is partially healed, the surgeon will perform the first trach change at day 5 to 6 after surgery. Most surgeries carry risks. The potential risks for trach surgery include complications from general anesthesia, injury to the windpipe, nerves, or blood vessels, and in extremely rare cases, risk of brain injury or death from difficulty securing the airway. After the surgery, the potential risks include the trach tube accidentally falling out or being plugged, which could result in your child not being able to breathe, possible infection, and bleeding, scarring, or wound issues at the trach site. We know this is a lot of information to take in, but it is important that you fully understand the risk of the surgery as well as learning to live with and adapt to a tracheostomy. Remember that you're never alone. Your care team, as well as other families, are here to support you and your child. Your child's trach is their lifeline. Great care must be taken to make sure the tube remains clear and does not fall out. For this reason, caring for a child with a tracheostomy is a 24-hour-a-day job. At least 2 or 3 members of your family should receive trach training. Please be prepared for a hospital stay that could last a month or longer after the surgery. During this time, we will provide you with the proper training so you can care for your child at home. Your training will begin immediately, first with the mannequin and watching the staff care for your child. You will learn how to clean your child's neck and trach tube, how to suction the trach, change the trach, and troubleshoot any problems. The training is complete when you're comfortable with providing the care on your own. If your child is able to go home, in most cases, it is essential that a responsible adult is awake and caring for your child 24 hours a day. Some families must hire nurses to help, while others enlist family members. Sometimes, families do not have the resources for 24-hour-a-day care, in which case your child must be cared for at a nursing facility. Caring for a child who needs a tracheostomy is not an easy road, but a trach is a life-saving tool, and it can allow your child to grow and thrive. Remember, every child is different, and their trach experience can vary widely. We encourage you to research and reach out to your care team with any questions you have. Thank you for watching, and thank you for being a part of the UCSF Health family.